Australia, Sydney, Australia. Today we have brought volunteer physiotherapists and doctors from Italy to do this 4-day training program. I'd like to thank the local organisation of this university hospital, correct? And the hospital giving the availability of the area, the room, okay, the therapists, because here we have a group of physical therapists, occupational therapists, correct, and nursing staff. And so we will be, over the next 4 days, passing on the information about this new rehabilitation technique, which is low technology, but highly manual as a treatment therapy. So hopefully today we will be seeing some patients together, and obviously tomorrow morning we'll be seeing many patients, so you will be able to see very quickly how this technique works. So I'd like to thank the hospital and the administration, the direction of the hospital for allowing us to do this training program here. This will hopefully be the first of 3 different training programs over the next 13 months. I'd like also to invite Claudio from the organization Butterfly, which is a non-profit organization which has been the driving force in the organization of this training tool. Okay.
Yeah. I just want to say 2 words. We are mainly concerned in water project here in Tigray and the education. So we are not really connected with a medical institution, but we have a lot of friends. We met last year Dr. Jemai, so we came up with the idea to put our forces together. So that's why we came here today. And well, we want to thank you, all of you, for being here. And obviously all the concerned people for having organized this training course. Thank you for your attendance.
My name is Girmay. I'm the manager of Mekelle Orthophysiotherapy Center. Today we are providing training for health professionals, physiotherapists and nurses concerning neuromuscular training, which is a low-level technology and effective treatment, which is new to our country, to our professionals, health professionals. This training program is provided through the collaboration of Mekelle University Medical Science College, Foundation Butterfly ONLUS, Neuromuscular Taping Institution, and Tigray Disabled Veterans Association and Mekelle Ortho Physiotherapy Center. The trainers are around 50. The training will be stay 4 days, practically and theoretically, and the rest 4 days will be, we are going to provide in every hospitals, provide service, neuromuscular taping service to our patients. We expect around 150 patients will be get training, such kind of treatment, and most of them they are clamp feet, amputee rehabilitation, stroke patients, mostly concerning with neuro and muscular health problem. Our project it will be continue in 2015. In the coming August and the beginning of January 2006, we are going also to provide training together with all stakeholders, and a lot of health professionals will be trained, and most of our patients they will get access such kind of treatment.
Yeah.
And finally, I would like to say thank you to all partners like Foundation, Butterfly ONLUS, Neuro Muscular Institution, Mekelle University Medical Science College, and Tigray Disabled Veterans Association for their collaboration, for their support. And I hope this project will continue, and we are going to create access to all disabled people of the region. Thank you.
Thank you.
Hello, my name is David Blow, and I'm from the Neuromuscular Taping Institute in Rome, also in New York. This is an introductory neuromuscular taping basic course that we are holding here in Mekelle in Ethiopia. It is a 4-day intensive training course, following up with 4 days of intensive training of people who we train in their real hospital situations. The objective here is to introduce to Ethiopia a new rehabilitation technique, which is based upon low-level technology. If you're aware that, as you know, neuromuscular taping uses a simple cotton tape with elastic fiber, contains no medication. It is a simple tape that we apply over the body, following a longitudinal anatomy of the muscle, tendon, skeletal structure, but most importantly, following the longitudinal elasticity of the skin. So our objective is to apply a tape to increase the blood circulation drainage over the area that we treat, and so consequently we are going to assist in rehabilitation. Our objective is to introduce to Ethiopia a very manual, low technology, which means low cost therapeutic system, which exists in Italy, in the United States, and several other countries. This is a course, a practical course, together with Mekelle University, Mekelle Hospital, and the Mekelle Orthopedic Therapeutic Services Clinic. Thanks to them, we are able to bring a volunteer group to Mekelle in Ethiopia, comprising of 6 physical therapists, 1 doctor specialized in rehabilitation, who has assisted in the training process and to see the various patients that we will see over the next 8 days. Oh, you can sit here as well. Okay. Okay, so. Okay. Okay. Can you take this off? Is that possible? Can you take the shirt off? Okay. Okay, so, and extend the arm as much as possible. Okay, so you see here, the elbow does not have the full extension. Okay, here she has full extension of the elbow. Okay, so here. Okay, so you see the biceps is more stiff, more tight. Biceps also on the. Okay, on the forearm, on the flexors and extensors, there is not much problem. There's a little bit of tightness here in the muscle. Okay. If your here is softer, here is slightly harder, but she has a good, okay, flexion and extension of the wrist. Okay. You want to stand up? Yeah, that's just. Oh, okay. Okay, so extend the arms up like this, okay? So she has a little bit of difficulty in the hyperextension, okay? Yeah. Just sit there for a second. Can I have a pink tape I think blue tape or something. Okay. So we are going to apply a tape to improve the mobility of the shoulder and the extension of the elbow, which means we're going to use a technique which is called a fan on the shoulder, anterior and posterior, so to improve the mobility. So here we're going to take a measurement. Just hold that like that. Okay. So over the shoulder, okay, up until the elbow, which is like this. Okay. So this is the length of the tape. Is to improve muscle elasticity, correct? She has muscle tone. In fact, her biceps has too much. Okay, one. Yeah, still with flex like that. Okay. Just keep it like that for a second, okay? And now we just lower the elbow like this. Oh. Okay. The major problem is always the roots of the brachial plexus, which is here. Okay, so this is the origin of the problem. So what we have to do next to the cervical spine, we have to birthing, okay? It can be just be stretched or it can be broken. If the nerve fiber is broken, then we have little, we don't have much to do. But if it is just stretched, okay, hip down, head down. Okay? Yeah, okay. Strips, okay, two side, two on one side, two on the other side. Our objective is on that muscle fiber. All cerebral palsy will have the neck muscles very tight, okay? Neck muscles very tight, which is going to create compression on the roots of the brachial plexus. So our objective is to reduce the muscle contraction to help any sort of neurological flow. Okay? So, okay, you want to sit? You want to sit here again? Okay. So we're going to extend the arms over the head again, just to test as before. Okay. Very good. I'll give this back to you. Okay, give me your hands again. Okay. Okay, you can even see there is a slight improvement. You see there is a slight improvement in the height. Okay. So the elbow. So we're going to apply the tape for where you can say we're going to apply the tape for 2 days, and if he can come back on Monday morning, and so we evaluate, then we change the tape. Hemorrhagic. Okay. So, okay, with central brain hemorrhage, what is the problem? The problem is congested. Okay, so, okay, you have to stop the hemorrhaging, but you have all the blood hematic substances which are creating internal pressure, which is creating pressure over the nervous system, and so obviously we have paralysis. Okay? So, also, she has pain in the elbow or not? You have pain like that? No? No? Okay. Okay then. Okay. Okay. So, I just want you to lift your arm up again. No, lift your arm. No, just by yourself. Okay. And then go down. Okay. Bring it up again. And then go down. On the brachial plexus. She does not have that problem, but she has a difficulty in the coordination of the upper arm. Okay. So the roots of the nervous system for the upper arm starts at the cervical area. So the first treatment we have to do for her before we start treating the hand is on the neck. So can I get you to stand up? Okay, and we turn around. Okay. So it's when she comes back, okay, you see how the tape is working on the muscle fiber beside the spine. So, okay. Okay. So you can feel that the fingers are starting to get softer and they extend much faster, just like that. Okay? Cement. So we're going to apply the tape 2 centimeters on one side and 2 centimeters on the other side. Okay, just like that. Okay. So we're going to take off the paper, fold like that. Okay, make sure there's no tension. We're going to apply the tape centering the muscle fiber in the middle. Here is the vertebra, so it's 2 centimeters lateral to the vertebra, and then we're going to stick it like that and then rub on top. Okay, so this is a Balotelli taping. No tension. Okay? You start at the same point, you finish at the same point. And then you rub on top. Okay? They always have to be exactly the same. Exactly. So when he comes up, perfect. Okay? So you see the wrinkles? Okay? If there is no wrinkle, it's going to be compression. Now we have to activate the tape. How do we activate the tape? By walking. You want to walk? Wrinkles. No wrinkles. 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 Okay? 5 times. So in your clinic, you have to do that. You put the tape and you activate. You get the walk around. Go. Go down again. Go to where you can go. 5 centimeters. Oops, a little bit more. Very good. Okay, so here you have the tragus, just in front of the ear, and here you have the main point of the facial nerve, okay, and also of the trigeminal nerve, okay. So we have 3 directions, 1, 2, and 3. So we have to get to the corner of the mouth, okay, but in this direction, okay. So the first strip, the skin here is elastic in this direction. It is not elastic in that direction. Number 4, you feel the medial border of the patella. You go cover that tuberosity, and you go down towards the lateral ankle. You start medial, but you finish lateral. And you open medial condyle over the tibia, okay? Just like that. So you have to finish like this, okay? Tape and another. Do not stretch the tape. Okay, so lean towards the front so we can see. Okay. Take off the paper, don't stretch, lay it down. Don't cover one strip to another, okay? We're not going to cover the tape. They're going to be separate. Okay. To be stretched. If you apply the tape here, then it is going to be compression. So you have to apply the tape where the skin is stretched, okay? She has a good flexion. If she has limited flexion, what do? Stretch the tape or stretch the skin? Okay, very quick. Okay. Yeah, the hand is going to be difficult, but flex, relax. Okay. Okay. And then you see the range of movement. Yeah. Okay. And like this. Okay. So extend. So you have to do all the sorts of movements possible. Okay. The decompression on the nerve system, okay, so as the patient can start moving again. Too much immobility is going to create this sort of situation, okay, a Sudek situation, okay. So we need to apply a tape over the cause. Here is the cause, here is the cause, okay. This is the symptom and causes, okay. So here he has the skin which is still open, so he still has one stitch here, okay? And so here we have some crusting. So we are not going to cover the skin where there is still a surgical stitch, okay? Sutura. So we are going to apply a tape, so you feel, okay? You even see the color differentiation, okay? We still have lots of congestion in the area, okay? So when you touch, you feel it's very hard, okay? Okay? Your nose? Yeah? You just want creases. Okay, so 1, 2. So you see, there's no stitches. The skin is closed. We can cover it or we can't cover it. We can cover it. If the skin is open, we can't cover it. If the skin is closed, we can cover it. So stretch over the middle. Just like that. Okay. Okay, now we're going to lower it to 45. Okay. Then we're going to stretch and to apply. We're going to stretch and to apply. Make sure it's going to be stuck very well before you move, okay? If you move too quickly, then the tape is not going to stick, okay? Which is very common with amputation. Where is the problem? The problem is here or the problem is there? The problem is there. Okay? So why is the problem here and not here? Because here we have lots of adhesion on the scar tissue. So we have scar tissue and we have lots of compression. So the compression over the skin receptors, muscle receptors, mechanical receptors are all squashed like this. So when you have a receptor which is squashed like that for a long period of time, it is going to give you false reading, false feedback. So creating a pain syndrome and pain on the limb which doesn't exist anymore. So for us, okay, we can treat this very easily by applying a tape which is going to do what? Decompression. Okay, over the scar tissue. Okay, and so usually in these situations the phantom pain reduces very quickly, and the protocol of treatment is 10 treatments. So we're going to apply the tape 2 times a week for 5 weeks. So that is the protocol. Okay, obviously we have 25 years has passed. Okay, so 25 years of compression. Very strong adhesion over the scar tissue, we'll see now, okay? So, okay, even though lots of time has passed, the tape is still going to create decompression in the local area, okay? And so from experience, whether it is an acute phase, okay, which means amputation only for 3-6 months, or after many years, the result is still very interesting, okay? So, okay, so we have the length in around 15 to 20 centimeters up until the hip, okay? So we have scar tissue underneath, like this. You see here, when you pull the skin, you see you have adhesion, not on a skin level, not on a connective fiber level, not on a muscle or tendon. We have adhesion on the bone level, okay? So you see here, when we pull the skin, okay, you see how it is adhered to the bone, exactly there, okay? So then we have to stretch down and to apply, and let go. Yeah. Stretch and to apply. In there, okay, you see, you have to bring it over, apply the tape over the scar, and then stretch up in this case, apply the tape, and then stretch down. Okay, like that. Okay, so when you bring your leg up, bring up, okay? You see how many wrinkles there are? Just bring up. Okay, very good. And then down. Okay, so bring it down again. Okay. Down. Down. Okay, so on this side, stretch the skin here. So, leg down, yeah. So here we have to, okay, cover the scar tissue, stretch the skin, cover the scar tissue, stretch the skin just like that, and to apply the tape, okay? And then let go. So stretch the skin up, stretch the skin down, and no tension. Stretch the skin as you apply the base. Then, again, in this way. Stretch the skin. Okay, next one. With your leg towards the front. Put this leg towards the front. No. Okay, put your leg towards the front. Okay, perfect. Just hold like that. Okay. See, put this on your nose. You see, already the skin is more mobile. Okay, more fluid in its movement. You see that? Already, you see there is less adhesion. It is softer. Okay. Okay. So decompression like this. More movement he does, the more decompression there will be. Okay, just like that. Okay. And has had 26 years ago a gunshot wound, okay, causing trauma. Yeah. Ah, you're a fighter. I see. Okay, so. Okay, so she had trauma, okay, on one side, creating the paralysis, okay, so for 26 years. Central nervous system damage, you're always going to apply the tape starting at the neck. Okay, rub on top several times before you move. Okay, just like that. Okay, so here. Okay, so now you turn off the biceps, also here. You're going to stretch and to apply the tape, okay? Oops, okay, okay. A little bit less. Okay? Okay now?
Yes.
Okay. You just tell me if it's too painful, okay? Okay. So stretching up like that, and then down. Okay, so going down. Okay. Very good. So there, when we flex, just try and bend. Bend your elbow. Okay, and then extend. When we bend again, try and bend. Okay, just follow me. Okay, very good. And again. Very good. And again. Okay, very good. Okay, very good. Okay, so how many tapes we apply depends upon the dimension of the elbow. Okay, so here we can apply one more, and then we have to change position. Okay, stretch the skin, and to apply it like that. Okay, okay. Give me like that. Okay, bend your elbow. Push, push. Okay. And then we're going to do it together with the movement. So flex, bend your elbow, okay? And then extend, bend and extend. Together, together, together. So this is often the problem here with the, okay, you see with the concept you have the skin which is folding like that. Okay. Okay. Oh, hello. 6 weeks. Okay. Okay, so this is a follow-up patient. So a patient's already had 6 weeks of Ponseti plaster casting. And so you see, this is a bilateral, so the result is it's very good, okay? So we have, you see the folding of the skin here, which is very typical in these situations. So our objective here is to apply a tape even on the foot to improve the elasticity, on the Achilles tendon, and also on the tibia muscles. The knee has good functionality, okay, also the hip. So we're just going to apply the tape on the anterior tibia and the Achilles tendon to increase the elasticity, okay? Okay. Here is the head of the fibula, okay? And the tuberosity, tibial tuberosity. So we need to take off, just like this. We do it in 2 segments. Okay, so I'm going to hold the foot into this position. We could stretch the skin up. Okay, so even here we can put the child on the side. Okay, apply the tape on the heel, stretch the skin in both directions, apply. Okay. And so stretching the skin up, centering the muscle fiber, and centering the muscle fiber. Okay, getting to the popliteal fossa and also slightly over as well. Okay. Okay. So you feel straight away. Okay, come and feel. Okay, because the child has been pulled, or you don't know? Okay, yeah. But the head is okay? The head is
Okay.
The head is moving okay?
He's making
Problem here is extension of the shoulder. The brachial plexus has been stretched excessively during the birth. So we see here by the X-ray that we have excessive space between the head of the humerus and the acromion. So even looking at the child here, the child has on the left side the arm which is perhaps 4 centimeters longer. So we're going to apply a tape. There is no evident problem with the neck, so we're going to apply a tape with a fan technique over the anterior posterior shoulder, focusing on the brachial plexus to help dilate the area, to help any sort of re-innervation of the brachial plexus. Child had mobility of the limb, so we have a flaccid sort of paralysis at the moment. So we have to apply a tape for various objectives. One of those is also to limit the spasticity, which will come over time. Okay. How old is the child? We have a young girl, 18 years old, with facial paralysis on the left side caused by cold. 5 days ago, started with a cold sensation, numb sensation on her head, and now she has a very slight facial paralysis. So when you close your eyes, okay, and open your eyes, and then okay, so mostly around the eye, okay, and we're going to apply the tape to help improve the dilation of the facial nerve, okay?
Puoi fare delle foto prima e dopo?
Sì. Okay, if we can just take a photograph, photograph. Okay, kiss.
More very
Ok.
per
sopra.
No, quanti sono 4
4 e tagliamo anche questo
per l'occhio
laterale.
laterale.
Okay. We lui che ha una linea ai capelli bassa, ok? Ok? Vuoi finire?
Sì, facci. Me l'ha fatto troppo corto. Fai togliere lui, se no. Ok, do it sometimes. This movement, ok. Okay, let's do. And close. Okay, open. Close. Okay, open. Let's do. Okay. Okay.
For organizing this course, and I know that we will do some interesting collaboration in the future. Okay, so I'd like to thank you all also for resisting the last 7 days. Okay, because we always do training very intensively. Okay, so if you are tired, I'm happy that you are tired. Okay, because when you are tired, you learn more. Okay, so we always do full-on training for 7 to 8 days, and then we go and then we come back. Okay, so this is the way that we train. Okay, so thank you for your resistance, and hopefully we'll see you all again in 6 months. Oh, this afternoon, also in 6 months. Okay.
Alganish Taraka. Said Abdelkader.
No, dai, c'è pantaloni.
Pronti?